communities and even at schools to raise awareness on disaster risks, which includes different types of hazards. And last speaker was about CBRN. An expert on CBRN from Australia, Mr. Jeff Walker, stressed the importance of the approach, all-NGC approach. And CBRN are always unpredictable, therefore easy to cause an intense reaction. To avoid that, it is crucial to understand the risks and the role of each agencies and organizations with a clear instant command system. So you can see the video recorded of this session on the YouTube. And also the second session, which was conducted on 14th of October, the topic was strengthening disaster management strategies through multi-stakeholder partnerships. So that the key word here is that multi-stakeholder partnerships. And the speaker from UN Disaster Risk Reduction Office is that he showed the collaboration mechanism at the regional level. And at first, he highlighted the 30 years of progress and achievements in disaster risk reduction. And for instance, a structural dialogue from global to local, which means many platforms and conferences that various stakeholders can participate, such as a ministerial conference or a global platform, was organized in many conferences. In this kind of dialogues were done in the last 30 years. And second one is that establishment of international structures on disaster risk management by appointing a dedicated government institution and focal points. Then third one is that developing disaster risk management policies and strategies and plans. And then the fourth point is that another was that stakeholder engagement. So various stakeholder groups were formed under science and technology and civil society, private sector, etc. So all these groups include a lot of different types of organizations, and each stakeholder group discuss the common challenges and how to tackle these issues among that group. Then after that, and at a global platform and regional conference, they bring all these topics and they can exchange and information and discuss the common challenges. So that's the sort of the regional mechanism. But the next question is, how could we work together, including experts of different types of hazards? So far, we were focusing on natural hazards, but rather now we really have to emphasize also the importance of expanding our scope to biological and chemical and different types of disasters. Then the second speaker is from the UNICRI, United Nations Interregional Crime and Justice Research Institute, and also the EU CBRN Centers of Excellence. And he's talked about collaboration at the national level. And he introduced a collaborative mechanism at national level, and his organization aims to mitigate CBRN risks with partner countries, working with national stakeholders for capacity building, prevention, and response to CBRN emergencies. And he introduced the mechanism of national coordination. And each country has a CBRN national team, which consists of different ministries, sectors, and groups. For example, Ministry of Defense, Ministry of Foreign Affairs, and Ministry of Education, Health, etc. And also the civil society organizations, universities are also involved in this national team. And they try to implement all society approach to work together to address the needs for identifying the CBRN, different CBRN risks. And he also highlighted, in order to work for different types of disasters, he stressed that there's no need to highlight distinctions too much among these different hazards. But it is more important to have a holistic approach, focusing on the similarities in impacts and response. So this is, I think, the direction of what we are aiming for right now. Not really talking about the difference, but rather we should identify the common and also the similar elements in different disasters. Then we have to discuss how we can work together and strengthen the common areas. And the third speaker is from the International Army Agency Engineers Corps, Government of Indonesia. And he also shared his experience at ongoing response to COVID-19 pandemic. And his key message, or firstly, is it will take time to require proper budget allocations and enduring supports from all related stakeholders to build a sufficient national capacity and capability for responding to NATIC and CBRN disasters. So we sometimes forget about the necessary budget allocations whenever we do something. But it is very important message to the government and also the local governments. It is very important to allocate certain amount of budgets to make sure sufficient preparedness capacity. Then if it is fails, he mentioned, those events can quickly overwhelm the infrastructure and capability of the responders and have the potential to destabilize governments, create conditions that exacerbate violence or promote terrorism. So reminding these points, so we'd like to start that today's session, the title, Developing Innovative Tools and Approaches for Disaster Preparedness and Response. And as I mentioned, we have excellent speakers today, 4 speakers from different organizations and also the countries. So now I'd like to introduce the first speaker, Dr. Ranit Chatterjee, and from Kyoto University. He is a researcher at Kyoto University and co-founder of RICA India. I think he will talk about this institution more details in his presentation. And he is a societal entrepreneur startup. And his work cuts across government, private sector, and community, among others, while focusing on disaster risk reduction and climate change adaptation. And he's one of the founding member of Inspire Alliance, is an integrated research on disaster risk, IRDR young scientist, and works towards achieving Sendai framework for disaster risk reduction targets for promoting science and technology in disaster risk reduction. So Dr. Ranit, and floor is yours. Thank you.
Thank you. Thank you so much, Professor Izumi, and a very good evening to everyone joining me today from different parts of the world. I'll possibly take you through this journey of like presenting on what would be a solution for managing different disasters, and possibly looking at the kind of solution from the lens of innovation. Because if we are talking about innovation, disaster, in many cases, I guess now everyone is preparing themselves to manage disasters, but still we are somewhere falling short. And where we are falling short, that's where we need to come up with new ideas, new solutions to tackle where we are falling short. So that's where innovation comes as a very apt kind of an approach to cap this gap. And so for my presentation today is divided into 2 parts, basically looking at the role of innovation, science and technology, which would be a shorter part, like just giving you a brief idea, especially in context of the present crisis, which I am sure everyone is trying to grapple with. And then the second part would be giving kind of sharing with you a recent tool that was developed. I was part of developing that tool for even DRR, focusing on the risk estimation of micro, small enterprises. So before we move ahead, I'm sure many of you have heard this kind of saying, necessity is the mother of invention. And I intentionally put it here because many a times we confuse between these 2 words, innovation and invention. And not to stretch it too much, I would say innovation and invention is related, but possibly innovation is a much bigger umbrella wherein the invention fits in. So if we extend this saying, it actually can be also said that necessity is the mother of innovation as well. And I hope everyone joining us here would agree that possibly we are facing such a necessity now, at least for last 10 months, where it's possibly our very basic things that we do, like we breathe, or we move around, we socialize. There are restrictions that has been put in, but possibly one thing where we can still freely freely use is possibly our ideas, our thought process. And that's something which is very core or the crux of innovation. And what we do in innovation is basically we gather new knowledge and we try to see how we incorporate that knowledge into products, processes, and services, which has a kind of changing effect on certain elements or some system which is already in place for possibly public good. So that's in a nutshell what innovation does. And I think all of you here are very well aware of the Sendai framework. And innovation is something, not a new thing. It has been happening from ages. And especially in disaster management also, it's now getting very highlighted, especially in this pandemic situation. But it has been there as part of the global policies way back. If I look back at Hyogo framework, there was already mention of innovation and education for building cultural safety. Sendai framework has been promoting innovation for science and technology, and also calling for investment in innovation and technology. So it already is possibly, it was already part of it, but the need or the necessity is much higher now when we feel that we need to do something. We need to have solutions. And that's what is now, I guess, pushing us towards looking at innovation much closely. Well, we generally hear these three words together: science, technology, and innovation. But they are not like the same thing. Possibly science give us our understanding of the problem or the method, possible method that we can take, or and also give us ways to generate evidences. Whereas technology gives us the platform and is kind of an enabler. Say, when we are looking at, I am sure many of you have already used different kind of applications on your mobile. So those applications possibly are the innovative applications that has been done. But if you look at the mobile technology, it is already there for a long period. So the technology is possibly the platform which helps us in reaching out to the community or people whom we want to reach, or the customer base. Whereas innovation is possibly the idea, knowledge, or also the way to customize certain things which are already there, but we are trying to repackage it so that it can suit the need in a specific context. So this is how these three words actually come together: science, technology, and innovation. They are very much they work in tandem, but still their kind of role is different, and that is very important to understand. While in present pandemic times, if you look at innovation, how it has played out, possibly what we see now, most of the innovations are focusing on the first circle, which is this dark brown circle, with, on what we are observing every day, the challenges or observed impacts. And then most of these innovations are trying to apply solutions directly to solve these issues. And possibly one of the area where most of the innovations are happening is related to health. But also you can find innovative solutions focusing on education, or also on funding and other sectors. But health is possibly the prime target of innovation that we are seeing, that is unfolding everywhere in different across the globe. But as we proceed, because what we are facing now, we are still having kind of COVID infection spread across a community. So possibly what we are, this will change over a period of time, and the perceived impacts and would then slowly become the observed impacts. Which are the perceived impacts are those which we are trying to see that, okay, possibly those are the perceived that can happen, and we need to tackle those. So it will slowly move into the first circle and become observed impacts over a period of time. And right now, there are very few innovative solutions which are actually focusing on this perceived impacts. But as the time passes, those will become observed impacts. And then at this point of time, we are not looking at the long-term solution, say, okay, once this COVID pandemic is, say, the waves stop, the infection waves stop, and then what would be the impact on the economy? How will we manage it? What would be the social challenges that will come up? So we are not focusing on that. And possibly when we look at that, that will again get mainstreamed into the pre-COVID themes, which were there for innovation. So that's how this whole process of innovation will keep changing over a period of time, especially in this pandemic situation. And if I look at this study, a recent study, this was done in early April or May, and it shows that most of this, as I said, most of these innovations right now are playing out for short term, where innovators are trying to kind of take advantage of the new market that is emerging, or possibly new themes, or say the health sector. We need to have some testing kit, or possibly a new approach or vaccine. So these are the riding out of the storm kind of thing, like where you are trying to focus on what is the flavor of the season. But then if you look at the top part, which is long-term, exploiting market change or envisioning future market, that's where possibly the innovations are less, because people are not perceiving that what would be the possible kind of future impact of this pandemic. And I think that's something which needs to be built into innovation for its long-term sustainability. And why I say this is because disaster itself becomes an enabler for innovation ecosystem. And why do I say that? Because we are looking at an uncertain period, and this uncertainty actually leads us to looking for solutions. And at the same time, there is a very high risk perception within the community, who understand now, like if I look at possibly the risk perception now and 1 year back, I would say that the risk perception has increased among people much. People in countries where there was no use of mask earlier, now everyone is concerned that whether concerned that, oh, someone is sneezing, you should wear a mask. So that perception of risk has gone very high. The variations based on local context is because we are trying to see how things are changing based on a very micro level situation. It's not something which is happening globally, but actually happening locally, and we are trying to manage them through local actions. We are also facing this challenge of response gaps. As I've already said, there is a high market demand. If you have a vaccine, say today, there would be like everyone jumping onto you and say that, oh, you have a vaccine, give it to me. So I'm just giving an example. That's like vaccine is like possibly the highest level of innovation, or some like. But even if you have a very simple solution, people would jump on and say that, oh, this is something which we have, we possibly would like to take it. There is a lot of, and with high market demand also comes fund, and there's a lot of funding. And I'm sure people from different countries have already experienced that, how there's a lot of funds from the government, from different funding agencies coming in and saying that, oh, we can fund you, you have a solution, okay, we can fund you. And then also innovation is very important for a better recovery, because what we are building now today is possibly we are trying to look at the future so that we mitigate any such future challenges that might arise of such kind of a pandemic situation. So if I look at also the study done by McKinsey in April 2020, it also has a similar kind of similar finding to share. If you see the left-hand corner graph in light blue, so you can see that most of this surveyed kind of people said that the innovation, the economic recovery, which is D, and C, which is like end of health crisis, that's where the innovation would actually take over in comparison to all the other things like maintenance, organizational health, efficiency, core. So along all this, possibly the innovation is where people would look forward to for the long-term solutions. And what are the benefits of innovation? Possibly the benefits of innovation, if we are looking at like the cost benefit, most of these innovations which are coming up are like have low cost, allows co-creation. So it actually helps in bringing in interdisciplinary, multidisciplinary, transdisciplinary approaches to work together and solve problems together. It creates livelihood, especially for young entrepreneurs, and also at the local level, it would create livelihood options. It reduces response time. You are coming up with a solution which is trying to solve a problem, so it has a direct impact on the response time. It also gives a business opportunity, like say someone has a very bright idea, and if that actually applies to COVID, that person can start his or her own organization, and it becomes a business opportunity for that person. And lastly, like collaboration and partnership. So as I said, the co-creation also would lead to collaboration and partnership, new partnership building, as different experts, different individuals with different expertise would come together to look at a solution and try to bring in their expertise for a common goal. So these are possibly some benefits of innovation that we can look forward to. And this is a very interesting model, this like DOST model, so for innovation. And what it says is in innovation, there are 4 factors which are very important. One is duration. It's like the time when your idea is fresh. You have an idea, that's very nice, but is your idea fresh or is it already taken? That's very important for your idea to actually move into the next phase, which is opportunity. Do you have enough window to work on your idea? Did you do a feasibility study that, okay, I have an idea, but is it feasible? Is it going to make a difference? Is it actually solving a problem? Is it actually solving the real-time problem? So that opportunity window has to be taken, and your idea needs to be concretized within this window. Third is the transmission. How, once you kind of your idea, how you transmit, and this transmission is very important because people will come to know about your idea. Then that's where you look for funding, seek funding, or you look for collaboration. So the transmission part is very important for that idea to be picked up. And finally, how convincing is your idea for people to come on board and kind of make that idea work on ground, or people start acting on it. So this is possibly the 4 phases of an innovation, from its ideation to the ground implementation. So with that, I'll move on to a case which we recently developed for UNDRR. And here we were trying to focus on the micro, small, medium, not medium possibly, but micro and small enterprises. And I'm sure many of you would realize that micro, small enterprises are the ones who have been the most affected in this COVID pandemic situation. So the pandemic not only had a huge impact on the economy, and SMEs. SMEs here reads small and micro enterprises, not small and medium enterprises as it is in general understanding. Many SMEs also do not make BCPs. That's a fact, because that's very small ones do not need to make a BCP. It's not very feasible for them, like 4 people, 2 people running. Possibly people from the developed countries won't. If you have been to developing countries, you would realize that there are very small shops which are run from their house. Possibly they don't want to make a BCP. It's not very feasible for them. And people who have, or organizations who have actually made BCPs, very few had included pandemic risk, global pandemic risk, as one of the component which they need to mitigate. And then fifth is there is a lot of data gap, especially when we talk about the micro and small enterprises, because there is a lot of informality in the business where they do not report. Government has no idea of how they operate, where they are, how many of them are there. So, and that leads to also the issue of lack of baseline. So if we do not have data, how do we build a baseline of this? So these were the problems that we realized is kind of a issue if we want to focus on the small and micro enterprises to survive this pandemic. So with that, what we were also discussing is that what can we do for them? So possibly the 3 things that we can do for them is, can we make this whole process reactive to proactive? Like say, when we are currently, say if we are looking at this risk estimation, the tracking tools, it's more of a reactive approach where someone is getting affected, and then we are trying to detect that, okay, this person has been affected, this person has come in contact with this person, so contact tracing has happened, and we are trying to, that's the reactive process, because you are not able to guess where the risk lies, but you are just trying to stop some other people to get affected through the contact tracing. The second part is this helping in decision making through some evidences? And the third is the risk getting communicated to a wider audience? So these were the 3 thought process that came into our mind, that okay, can we take up these 3 issues and try to see if we can solve it for the micro small enterprises and bring them closer to the government as well. So with that, the design consideration for the tool were, one, very basic thing, because we are trying to reach out to a huge audience. So it should be very easy, something which is so easy that people can, like anyone can use it. The second, it should be scientific. The third, it should have data privacy. Fourth, it should be adaptable. And fifth, it should be scalable. So these were the 5 design considerations that we had. And with that, we came up with this quick risk estimation tool. You can all access it. It's available online, and the link is there at the bottom. So here we kind of made a framework which takes into consideration 2 kinds of risk. One is external risk and internal risk. Organization would have its own internal risk, which plays out as a factor of technology, human resource, finance, operations, and external risk, which plays out in terms of exposure to hazards, change in the market condition, government regulations, which possibly as an organization, as a company, they won't have much kind of control, whereas they can control the internal processes on their own as an individual company. So these are the 2 specific risks that we took. And then we went for, like, there are 30 questions, because we didn't want it to be a long, like ILO has already made such a kind of, they have done a detailed questionnaire tool, which is 80 questions. But it's very difficult for someone to sit and do 80 questions. So we made it 30 questions. We have made a weighted mean approach where you can see your risk level. Then it can generate advisory. And then at the back end, it can also become a database for future use. And that can lead to decision-making process. So once you take this tool, like questionnaire survey, what it does, this is the dashboard. So it shows what is the risk. Like after you complete it, it shows that whether your company is at high risk, low risk, medium risk. And then it also shows a disaggregated risk chart, which shows that, okay, say in human resource, possibly the lowest score can be 1 and the highest score can be 12. And where do your risk lie? Say your risk is possibly 4. So you possibly are doing better. Or your risk is very high when it comes to external risk of hazards. So your risk is like 3 out of 4. So you're possibly at higher risk. So this is some area which you need to manage. So here you can make an kind of consensus, kind of decision based on this kind of a tool and the outcome of it. And then you can take this tool twice, say over a period of like you can come back and use this tool next month and see that how this risk has changed. So if you see the other line here, it shows the past score and the present score in blue. Deep dark blue is present score. So you can see that how this risk is changing, and you can do it n number of times to see if your actions are actually helping you in bettering, reducing the risk. The other thing that it does is also shows, like, this is a global map. It plots your location and shows the risk, and it also can go zoom into a very small area, and if people start populating it, you can see that which area has more risk, and then the government officials can actually make decisions. And this is an estimated risk, so possibly there is still a scope to make mitigated, like take actions before possibly there is a big catastrophic impact on this area. And then it also issues advisory in terms of what you should do and what you should and what you can do. Like, say, this automatically tells you which are the areas where the risk is high, and also it connects to the other UNDRR tool, which talks about this toolkit, which helps one organization to develop a business continuity plan, or it can also links to this training session by UNDRR on the COVID-19 business continuity planning. So this itself becomes kind of a risk communication decision-making tool for government as well as the business owner, so that they can manage the COVID-19 risk. And then after the COVID-19 is over, possibly this can also be changed to fit into other disasters or other hazards, like, say, earthquake or other things. So the whole model, like, possibly the questions can be changed, but the whole generic setup remains the same. So with that, thank you, and I'll look forward to your questions and clarifications.
Okay. Okay, thank you very much, Ranit, Dr. Ranit, for your wonderful presentation and very informative and introducing your case study. So also, I'd like to encourage the audience and participants to send their questions to Dr. Ranit. So okay, so I will take my privilege to ask you the first question, and thank you for your sharing your case studies. So is this the particular place you have done already, and what was the exact result by using your tool?
Yep, thank you for that question. So this tool we have launched last month. UNDRR has launched it last month, and as of now, it has been propagated through the business like Arise platforms, as well as through UNDRR. But we have not yet kind of done webinars or done a mass propagation of this tool. So we don't have a huge kind of data set to work upon, but we have around 100 survey, kind of 100 people have used it, and recently we have translated it to Spanish for launching it in South Americas. So we have not gone into the kind of what do you call the analysis part, but that is something which we would do once we have at least a considerable amount of survey respondents. So that we have not yet done that part.
Thank you very much. So you also mentioned the organization RICA India, which probably they are deeply involved in the development of that tools. Would you please explain a little bit about that organization?
Sure. So RICA India is kind of a social entrepreneurship startup which we started, and me and Professor Rajiv Shaw, we kind of initiated it with the thought process that like disaster risk is increasing, but when we talk about disaster risk management, can it be a business case in itself? We don't have many good examples of organizations which purely focuses on disaster management. There are a lot of there are organizations which does that, but possibly kind of an organization which looks at innovation, looks into research, and try to connect research with the community. There might be not so many organizations. So we try to kind of fill this gap through RICA, and also kind of promote a disaster risk management as a professional career option for people who want to take it up as a career. For example, say I did my master's in disaster management from India, and then I used to work with UN organization in India. And when we were interacting with people initially, so the first instance, first response would be like, oh, you have done disaster management, that's very good, but whom do you work with? Is there any specific job that you can take up? And that also something that we faced when we graduated from our university, that where can we work? So, and that was 10 years back, but when I completed my PhD, I went back to India. I felt the same thing is still possibly there. The scope, there is a demand, but possibly there is not enough supply of organizations who can meet that demand. So we thought that this would be a good kind of institutional gap that can be filled up through RICA. And at RICA, we actually focus on two things. It's a hybrid where we do small consultancy works for research-based consultancy work, but we also do a lot of work on innovation and innovation, especially looking at how we can bring in research close and kind of research solutions to the community, and ask young minds to take it up as entrepreneurial initiatives through this, and we support them through kind of platform where they can showcase their work, or possibly they can interact with other such innovators. So what we are trying to do is RICA works more like an incubator in that sense for the young minds to showcase and bring about their ideas to an international platform. So that's in short what we do at RICA.
Okay, thank you, Renit. And I think that's a great and very fantastic initiative, because it's always the problem, we are seeing the gap between the research and also the practice. So as you mentioned, you can be the incubator to fill in the gap and connect the research and practical actions. So I really look forward to the development of your organization. So we have one question about your survey conducted. And who on the survey responded suitable for this tool?
Yeah, thank you for that question. In fact, this survey is specifically for the micro and small business. So it can be the business owners or business, someone who is working for that company who can take this survey. So here we are targeting the business companies or the business, not going beyond that.
Okay, thank you very much. So based on that survey you mentioned, you collected, how many samples?
We have now around 100 samples, but once we go, we are doing a webinar on the 4th of November. UNDRR is arranging this webinar with RICA and ADPC. So there we would kind of try to disseminate about this tool, how to use it. And also we are trying to kind of link it up with Facebook and other social media sites, and also retail, online retail platforms like say Alibaba or Amazon, where a lot of AWS, where a lot of these small businesses log in, and they can benefit from using this tool because it's an open, it's a free tool. It doesn't collect any personal data as such from the company. So it's something which can be easily used, and also this becomes kind of a tool which can generate like the risk of businesses across different region, micro level, macro level risk, and that can help us in making decisions, and also help the local government and the national government to make decisions, as well as make policies on managing this micro and small businesses.
Okay, thank you. So in that case, probably soon in the near future, and everyone can access to that tool if they want.
It is open now. Everyone can access. So if I can type it in the chat box, the link to the tool.
Yeah, that'd be wonderful. So what is, also the reason you mentioned small and the micro enterprises are the target of this tool. So is there any reason you also targeted and defined, say, the micro enterprises, not only the small one? What is the difference between small and micro?
Okay. The reason for kind of saying micro and small, in many countries, possibly the terminologies differ. Some countries do not have micro at all. They just are clubbed under small. So across region, this terminologies differ on MSME. Somewhere it is SME, somewhere it is MSME. MSME stands for micro, small, medium, whereas SME stands for small and medium. But the main thing is on two things. One is the capital investment, and the second is the number of staff or the labor force who are engaged. So micro would be a very small unit, for example, having 2-3 people working for it, and their investment would be very low. So for them, it doesn't become feasible to make a business continuity plan. They do not have expertise. They do not have that kind of funding thing to make it. So possibly this was also an effort to take them through this journey of how to make a business continuity plan. And the first step is knowing your risk. So if you take this tool, if you take this survey, basically you are trying to also know your own risk in the business.
Right. Thank you very much. So, and yes, you reiterate the importance of the BCPs, but I totally understand how difficult for these small and micro enterprises to develop the BCP by themselves, even though the big companies and a lot of companies who don't have the BCPs yet. So, and I am sure these are the very the great tools and useful tools for these small and micro enterprises. So we have another question. And how do you encourage as many as people to use the tools?
Right. No, that's a very important question. And what we are trying to now promote is through this Arise platform or the Chamber of Commerce in different countries, and also through the network of small business associations, that this is something which is free. And the incentive for you to do this is basically you can know your risk, you can take proper measures and see that if those measures are working for you or not. If it doesn't work, you can actually make changes. And that's something that keeps on happening in small businesses, because if you look at very small businesses, they are very dynamic. If one thing doesn't work, they immediately change. But they currently do it without knowing if that is actually helping them or not. So this can become a kind of benchmark to see if it is actually helping them or not. Otherwise, they keep on testing, but then there is a high chance that they are testing new water and it might fail. So this is kind of a safety mechanism for this very small businesses to trade into an area where they might not have too much of experience. So that would become an incentive for them to take it up.
Right, right. So related to that question, we have one more. Does the UNDRR plan on providing technical support to SMEs that utilize this new tool?
Yes. So UNDRR has already developed this COVID-19 BCP toolkit, and this becomes the first step before you move into the toolkit. So these all are integrated. That's why we have put specifically the UNDRR toolkit as one of the advisory or suggestive tool that can be taken up once you know your risk. So this becomes the first step to move into that tool. And also during the training programs, this tool is being propagated by UNDRR and ADPC.
Okay, great. Thank you so much, Ranit. And it is very encouraging to hear there is a lot of new tools and approaches are coming from Asian region. So all the best to your tool. Look forward to hearing more about your development of your tools and organization. Thank you very much, Dr. Ranit.
Thank you so much.
Thank you. Okay, so that now I'd like to introduce a second speaker. And I'd like to invite Mr. Israel Samihaldio. And he has been working for the Indonesian government for 34 years. And most of his services were dealing with disarmament, and started as a researcher at the Ministry of Defense in 1985. In 2006, he has been posted as the head of CBRN Directorate until 2013, and was appointed as a vice rector at the Indonesian State College for Intelligence Studies, or STIN, in 2013. And currently, he is a senior lecturer at STIN and head of Commission for Government Affairs of Jakarta City Research Council. And he got a master's degree on defense studies from the University of New South Wales, Australia in 2003. And he is now a doctorate candidate for human resources management at Universitas Negeri Jakarta. Okay, thank you so much for your participation, Mr. Israel, and the floor is yours.
Thank you very much, Izumi Sensei. It was a very nice presentation from who before Sanit from Sanit. It's a very nice tool, and my presentation don't provide tools. I just focus on approach for disaster and preparedness. So there are three keywords: disaster, preparedness, and response. Preparedness come before disaster, and response come after disaster. But sometimes preparedness also continue until the disaster finish. And response come when the disaster is occur. And of course, after the response, there are recovery and mitigation. But I would like to focus on the preparedness. At least there are several factors need to be considered. One is steps. Why I mention the steps? Because what I mean by steps is action that should be done one by one. One action should be done before another action. When one step finishes, then the other action is done. And the second factor is threat and risk assessment. I would like to argue that for the disaster, the threat and risk assessment should include the natural and unnatural disaster, or for CBRN or biological, natural and unnatural outbreak of disease. And another factor should be considered is organization. Like COVID case, for example, now WHO is playing a very important role. Every decision comes from WHO. Why there is no like a statement or argument from UND double R in this is a question from me. Why there is no statement from UNDRR for COVID?
Excuse me, Dr. Isloil, would you please show us the slides you have? Because
sorry.
the slides are not on the screen yet. Yes, but it's not really a screen. How do you call that? It's not slide show. I'm not sure how you can.
Do you see it? Do you see my slide?
It's not really the slideshow and wider screen. Can you make it as a slideshow and the whole entire screen?
Yes. I've already. Okay, I'll try. Is it so now?
Not really.
What about now?
Oh, actually, it's the same.
Can I come in here?
Yes, please.
I think we need to go with this your slide presentation as it is. So just please share what you did.
What about
It's perfect. It's perfect.
Yeah, now it's fine. Yeah.
Can you see my slides?
Yes, it's perfect
Okay.
now. Thank you.
Okay, I'm sorry for this problem. Okay, so my will for the disaster preparedness. My presentation is based on my experience. This is not from the survey or study, but from my experience. So talking about approach for disaster preparedness, there are three keywords. This is disaster, preparedness, and response. So preparedness comes before disaster, and response comes after the disaster. And but sometimes disaster should also consider the whole disaster process, and the response should also aware about the early detection. And for the preparedness, there are several things that should be considered. One is step. What I mean by step is action which is done in sequential. One action is finished, then the other action follow the previous step by sequential. And for the threat and risk assessment, I would like to argue that for the disaster, we have to include the natural and unnatural disaster. And for CBR and for biological, we have to consider whether it is a natural outbreak of disease or unnatural outbreak of disease. And for the organization, as we are known that now WHO is for the COVID is the most influential body. Everything's come from WHO. I have never statement from UNDRR. I don't know, maybe there are several statements, but I haven't found yet. And what about the other? Because like COVID is not only a domain of the health institution, because COVID is caused by the SARS-CoV-2. There should be a sort of research on the depth research on the virus itself. And talking about the organization, unfortunately, in Indonesia, there was Indonesian National Commission on Zoonosis, but it was closed in 2016. And there were also Indonesian National Commission on Infectious Emerging and Re-emerging Disease, or Indonesia we call it Komnas Pinere. It closed in 2016. It shows that there was no awareness, or maybe the government thought that, oh, there is no threat anymore from the zoonosis or from the emerging and re-emerging disease. So this organization, they think that this organization not useful anymore. So it's closed in 2006. And talking about the steps, there are 4 factors should be considered. First is early detection, and the second is early warning, anticipation, and what action to keep the preparedness. And for the threat and risk assessment, as I mentioned before, that we have to consider whether it is a deliberate or undeliberate action. And we have to detect or find the source of threats, either from internal or external. And talking about the early detection, we have to distinguish between detection and search, and specify what subjects or objects to be detected for preparedness. And for the early warning, I found that the awareness of the disaster is very low, either from the scientific or government sectors. And for the anticipation, it is very nice to hear that RANIT have the estimation tool to estimate the disaster. And I argue that the anticipation could be distinguished into several steps. First is foresight, forecasting, prediction, estimation, and anticipation. And to keep or to maintain the preparedness, we have to distinguish between prevention, countermeasure, and protection. And for the threats, based on my experiment or my experience, I'm sorry, a threat is the function of intention multiplied by capability, multiplied by opportunity, plus vulnerability. Intention and capability and opportunity is internal factor. External factor. This is from adversary, and vulnerability is internal factor. Why I use multiplication? Because if one factor, the value of one factor is 0, then there is no threat. Everything multiplied by 0 is 0. For example, someone have a bad intention to do terrorism or something like that, but they don't have capability and they don't have any opportunity. Then there is no threats. And concerning the source of threats, we can countering by formulate the regulation, legislation, code of conduct for scientists, safety culture, etc. sorry. Talking about detection, as I mentioned, we have to distinguish between detection and search. According to Oxford's dictionary, detection is the action or process of identifying the presence of something concealed, while search is finding, seeking, or looking carefully for identified object. So for the search, we have to find something that have already identified. But detection, we have to identify something which is concealed. Sometimes there are mix between detection and search. Of course, detection and search will be different if they differentiate between the two terminology. And talking about early warning is influenced by raising awareness. For example, COVID. When the COVID attacked Wuhan at the first stage, Wuhan maybe realized that it is airborne transmitted infectious disease. Then, because Wuhan aware that the COVID is airborne transmitted infectious disease, then the government locked down the city. What about the rest? And the rest of the world, they believe that COVID is transmitted by droplets. So most of the world doing social distancing and hand wash and using masks. So this one, Wuhan and the rest of the world, I argue that Wuhan have more aware than another part of the world. About anticipation. So I make sort of graph. This is the accuracy in the higher accuracy, this lower accuracy, and time. Estimation is having high accuracy, and it can predict a short time. And prediction, less accuracy, forecasting less accuracy, and foresight, less accuracy, but it used for make anticipation in the long term. And what about to maintaining the preparedness? We have to distinguish between prevention, countermeasure, and protection. Prevention is done when there is no disaster or there is no disease. For example, we drink vitamin to make our body immune. And countermeasure is done when the disaster or the outbreak is coming. So we counter the disease or outbreak. And protection is using tool to protect us from the attack of the disease or disaster. And as I mentioned before, that we have to consider in our assessment whether the disaster or the outbreak of disease like COVID, is it deliberate or undeliberate action. And as I mentioned before, that to assess the source of threats, we have to also to consider internal and external factor. And to prevent this kind of threats, I argue that there should be a legislation, code of conduct for scientists, and a safety culture. So to conclude, The preparedness can be done by defining and considering comprehensively the sequential steps, analyzing risks and threats, developing coordination body, interdisciplinary human resources, and maintaining the availability of facility and equipment. Preparedness of the disaster handling should include advanced systems for early detection, early warning, anticipation, include estimation, prevention, countermeasure, and protection. Due to the dual use characteristic of CBRN, the risk and threat analysis should include the possibility of natural and natural disaster. That's all my presentation. Thank you very much.
Thank you very much, Mr. Israel, and for your very informative presentation. And thank you so much for your explanation step by step on the preparedness and process. Okay, so we have one question to you, and please clarify the new aspects of the approach. How does the new approach compare to the old approach before COVID-19? What is the difference? You mentioned new and old approach.
I think the new approach, since my presentation is dealing with preparedness, for the new approach, we should use like intelligent methods. What I mean by intelligence is something that has been done before the real action is occur. So there is action or no action, we have to make preparedness. And the characteristic of intelligence is lies on the detection, on the early detection. So as I mentioned, and sorry, may I show again my slide?
Yes, please.
Okay, anyway, I mentioned in my slide that that should be early detection and early warning. So the new approach is how to improve the capability of detection and early warning.
Oh, okay. Thank you very much for your clarification. So we have another question: is what are the challenges of the new approach to be implemented?
The challenges, of course, because as I mentioned, that the definition of detection is to identify something concealed. So the challenge is how to find the method or the procedure to detect the factors which is concealed. So there are three types of detection. One is to detect something that has already finished in the past. Like, for example, coronavirus. There was a case in Spain in maybe 100 years ago. So we have to learn to detect what factors influencing this kind of outbreak of disease. And the second detection is detects something that is happen now, like COVID is happen now. So we have to detect, for example, which one is influencing the COVID? Is it airborne transmitted infectious disease, or transmitted only by droplets? I have no question for this question, but at least we have to detect this by now. And the other detection is to detect something in the future. As I mentioned earlier, we have to use foresighting, forecasting, prediction, estimation, and anticipation. There is a tool I do believe to do this this calculation. But at least there is 3 challenges. We have to detect something that has already happened in the past. We have to detect the action that occurring now, and we have to detect the action that have not occurred yet.
Okay, thank you very much. And also we have another question, probably that will be the last one. What is the best methods to do? First, as the public health to prepare for disaster management.
Can you repeat again? What?
Yeah. What is the best methodology to do the first as the public health to prepare for disaster management, probably in a health sector?
The best sector for the best method for the health sector is the same with the method I mentioned before. And there should be early detection, and after that there should be early detection can be defined into 7 steps. First is observation. After the observation, then doing detection. Observation and then monitoring. Monitoring is observation using tools. After doing monitoring, then doing surveillance. After that, doing what so-called recognition. We recognize the threat or the disease. After that, we do sort of reconnaissance. After reconnaissance, then identification. Then after identification, then investigation. I think that is the 7 methods. For me, it's a good method for the process of detection.
Okay, thank you so much, Mr. Israel, for your presentation and also the contribution to this session. And really appreciate your participation. And we hope and we can work together for the future risk management. Thank you very much.
My pleasure.
Okay, so now I'd like to introduce the third speaker, Mr. Andrew Raj, chairperson of the CBRNE NATEC Asian Disaster Risk Initiative, which is a CADRI for short. He is also the Southeast Asian Regional Director of the International Association for Counterterrorism and Security Professionals, Center for Security Studies based in Kuala Lumpur, Malaysia, as well as the Director of the Nordic Counterterrorism Network, a specialist think tank cum training center based in Finland. He has been also serving as a lecturer and a visiting and senior fellow for the School of Strategic and Global Studies at the University of Indonesia, the Observatory on Security and CBRNE Defense in Italy, and Maritime Security Center for Excellence in Turkey. So floor is yours, Mr. Raj.
Very much. I'd like to thank the APRU for having me on today, as well as being part of the organizing team. Thank you, University of Indonesia, as well as the Tohoku University Scientific Center run by Dr. Izumi. I would like to highlight an introduction, and my slides will probably be up and running right now. Yari, great, I see my slides up there. My presentation will talk about the multi-hazard threats and the risk mitigation. I'll kind of wrap up on these 3 webinars that we've been having on the basic issues on the multi-hazards and CBRNE risks. A very good morning from Helsinki, Finland. And before I start off, I would like to just kick off some issues here regarding to what is transpiring with the current pandemic, as well as the issues related to CBRNE and NATEC. Now, we've actually always wanted to ask this: how are the new technologies being derived? Now, I have 5 questions here that I'm just going to pose and move on to my presentation this morning. How are risk technologies redeployed from the commercial, environmental, and policing domains to the current fight of CBRNE, NATEC, and man-made disasters? How can the invocation of risk in the cause and fight against CBRNE, NATEC disasters be understood and conceptually? Do these moves embody transformation from sovereignty to governmental governments, from discipline to risk, from geopolitics to biopolitics? What are the implications of such moves for the population that come to be designated as risky or at risk? Where are the gaps, ambiguities, and potential resistance to these practices? Ladies and gentlemen, I'd like to start off my presentation by addressing these issues and the tools that have been realized recently under our organizations with our partner organization. Now, we're living in the new norm, living in fear, and the global security concerns are related to the economy, the disaster, pandemic, terrorism, and war. These are current security concerns by the international community, as well as the people within the regions and globally. The new threat that we see now producing tremendous effect, as well as bringing into considerations how to be prepared, are chemical, biological, radiological, nuclear, and natural technological threats, which include the concerns from chemical, biological, and radiological. Next, please. I think we should move to the next slide. Yeah. Living in a fearful climate, these are societal concerns that have gained tremendous effect in the last couple of months. What are the psychological injuries? How are they actually related to physical injury and the social cultural? Now, the first impact here that societal concerns are the physical injuries. What's transpiring now to civilians globally on the pandemic of the COVID-19? And how does it impact the psychological injury towards them, as well as the social cultural, which includes injury, mental health, anxiety, economy, and the future of the current situation. Next slide, please. Next, please. I think we're having a little bit of a technical problem here. Yeah, thank you.
Can I come in
please.
here and say quickly that there's a bit of lag here, so I'm judging it. It takes a couple of seconds, so
sure.
So worry about that.
All right. Okay. Looking at case scenarios in the 21st century, we see in 2002, the 9/11 and its horrific attacks on humanity and what it has caused the global community in its reaction and its fear. In 2011, the Great Tsunami in Sendai and the Fukushima disaster that released nuclear waste into the waters and created a major security and mental health, as well as public health issues in Japan. And in 2019, just last year, we saw the Hong Kong demonstrations, and within that organization, within that demonstrations, we also identified chemicals being missing from university research facilities. And these are issues that are just popping up globally, where chemical, biological materials are being stolen or misplaced or just being unidentified. And in 2020, we see COVID-19 and the Beirut hazardous blast that killed lots of people, brought down a city. People were not prepared. COVID-19 did the same thing. Now we look at the terrorists that evoke horror and the COVID-19 and CBRNE NATEC are discrete and remain low-key with an unpredictable rate of infections and consequences in the near and far future. So the current threat of CBRNE, NATEC, multi-hazards are increasing on a Richter scale. How likely is an unprecedented catastrophe? Why dwell on worst case scenarios? These are questions that need to be asked and answered in the near future. Next slide, please. Worst case scenario, the probability of a terrorist attack globally is high, but the risk to any one person remains low. This has been identified by the United Nations Security Council, as well as globally within governments predicting of terrorist attacks, as well as war kinds of guerrilla attacks. These predictions distort the proportional likelihood of the threat scenario. So what we have to do here is to be having responsible risk assessment, avoids this strategy if in place diligently by all. If we can have a fantastic, robust risk assessment, we can actually predict issues in the near future or in the long run to sustain our global livelihoods as well as our businesses and the protection of civilian lives. Next slide, please. I think we can't see the risk identifiers here. I got this from the internet, and we'll take a look at it, and we see reports and what are people trying to look into. Believe in it, report suspicious package, you be specifically afraid of something. So, I put this risk identifiers here just to play around to show what's important and what's not important, and how do we go about in identifying the risk that actually portrays to national security and the threat of our well-being. Next slide, please. Now here, I just wanted to touch on these issues. I know a lot of people are aware of what risk is, and I just wanted to touch on this before I move to my next presentations. What is risk? Widespread anxiety, toxic threats, which are industrial chemicals and pesticides. And then you have the natural disasters, which include fire, flood, pollution, etc. And then you have terrorism, which uses biological or even criminal activities that are now gaining popularity in gaining chemical and biological materials for purposes of disrupting the well-being of citizens, the economy, and whatnot. Next slide, please. Definitions. What are hazard? Hazard is a potential harm. Hazard is sometimes confused with risk. Now, risk is the probability that potential danger of a hazard will be realized. If a person is not exposed to a hazard, however dangerous, there is no risk. So what we are trying to identify here is to see what the risk approaches are to one in accordance to the current pandemic, which is actually gaining lots of momentum in sense of business continuity, people's livelihood, government's support structure for citizens, the public health sector, and how are we actually identifying and defining these risks. Now, similar with multi-hazards and CBRNE approaches, these may be the outcome. So, in addressing disasters, I think there was an earlier mention of how we should address disasters in identifying it, or how do we actually identify the risks portrayed by these. Now, Example, a fire is a hazard, but the risk varies within an apartment building block and the threat, or down the block or the neighbor, or a mile away from a chemical plant or port facility. These are risk assessments that we need to look into. The Beirut bombing, when we saw the blast that took place, how many people actually identified the threat of the severity of the fires that took place after the blast, whether how far down the block or the neighbor would be affected, or would it be a mile away from another chemical plant or port facilities that could have actually distorted or kind of affected the continuity of livelihoods within the community working in that facility. So what are the threats to this? Human lives, business continuity, the ignorance to comply to specific standards of operation modes. Now, there are so many variables under the taxonomies that we are looking into in actually predicting and identifying the risk that is actually evolving on a rapid scale. So what we have done here now is to actually come up with a proposal on how to address this new threat scenario by predictive analytics. Next slide, please. Now, experts believe that societal risk has never been less. Individuals believe that we face more risk than ever before, and the risk will be greater in the future. We have heard a couple of our speakers just now identifying this as well. So we see these risks in the future moving up. How do we actually do self-assessment tests on, and how do we actually do this without any tools? And I think Ranit mentioned about small micro economies and how they are operating without any avenues to identify such threats. And the UN came up with this new protocols for standard operations procedures that people can use for free. Now, industrial explosion releases toxic chemicals into the air, etc. Radioactive waste released from the soil seeps into homes and water. Other hazards buried under soil and pollution can create many other effects on life and security. So how do we actually assess this? Do we say number one on industrial explosion releases toxic chemicals into the air equals to medium low threat level? And if radioactive waste released from the soil that seeps into our homes or into the water functioning areas for the communities would be considered high, or whether the hazard buried under our soils, and there are many of these that are currently buried under the soil in developing countries that is a hazard to farmers as well as the livelihood. Now, do we consider this as medium, low, or high risk assessment? Now, if there is no predictive analytic tools coming up, the future seems to be a little bit grim due to the fact that how are we actually going to redeploy our new the new threats that are actually occurring, and how do we employ new technologies that are actually out there to attain some sort of predictions towards risks that we are actually going through right now. Next slide, please. What is the difference between risk and uncertainty? Risk can be calculated, the probability of winning the lottery, and uncertainty arises when the odds of success and the failure are incalculable, weighing the economic, political future of the consequences. So this is between risk and uncertainty. Next slide, please. Now, this is where we as experts and the individuals look into risk. Experts, We use probability and populations, odds of harm occurring to a percentage of population and the severity of the damage. The goal of the expert here is to protect the greatest number of people, the greatest amount of time in addressing the risks and the threats that will actually evolve and spread at a certain time frame. Now, individuals, we analyze the consequences of an event occurring independent of its likelihood. Now, the goal of an individual is to be protected all the time. So as individual citizens out there, we actually analyze the consequences of things happening and understand to our own set of mind that how we should be prepared and be protected all the time. And we have given that expertise to the experts to identify and to assist governments and communities in how to address a threat such as CBRNE and NATEC, natural technological disasters, from spreading and protecting civilian lives and the community. Next slide, please. Now, this is something that became very intrigued by taking things. Accidents are not random events. They are predictable. They can be identified and prevented. So by doing predictive analytics, machine learning, and the new technologies available, we should be able to move forward in actually predicting threats to our community, to our businesses. Next slide, please. My second presentation will now touch on the tool that the ISAP, working with the Organization for Security and CBRNE in Italy, recently developed a tool that has been rolled out and will be rolling out soon. It's an intelligent platform for predictive analytics and machine learning for natural, accidental, and intentional events. This tool is something that we are so happy to hear about and happy to roll it out recently. And we are looking into how we will be able to assist the current threats related to pandemic and any other threats arising from this tool. Next slide, please. The intelligent platform for natural, accidental, and intentional event. Now, the tool was established in April and started to roll out in early June to July. So we see the transformation fostered and development of new knowledge and technologies to improve the health and well-being. We looked into the risk scenarios related to natural events, accidents, conflicts, in order to identify how the platform would actually sustain and run. We looked into how the public health threats evolved and called for new approaches, identifying these issues globally. The current and future scientific technical developments will have an impact on the protection of citizens and the environment, as well as the strategic interests of countries and international communities. So these was learning processes that were identified by the team in Italy and its partners in using artificial intelligence. So the game changer here supports the analysis committed to deepening the knowledge of potential threats and the understanding of the future. This operational context took the 4 areas in understanding, reasoning, learning, and decision-making process to help identify future threats for businesses, organizations, NGOs, governments, public health sectors, as well as emergency responders. Next slide, please. Now, the key concept to the development of this software, high-level and complex tools are suitable for top-down information gathering analysis. They are state-of-the-art and leading solutions. Line tools can be at different levels, including where less skills and economic resources are available. So complex organizations, public administrations in developing countries, SMEs. Here we will identify SMEs as small, medium enterprise, or we can also utilize what Renee said as small micro organizations. Monitoring and having support with alerts, sentiment analysis on social media, monitoring local media, social media can be a game changer for local, small and medium players. And flexible tools can be quickly customized to work on both the web and static, structured and unstructured data. Spreading light tools can reinforce investigation capacity of the central level, providing reliable bottom-up support. So these were the key concepts in understanding the software development for predictive and machine analytics in addressing pandemic threats, not only pandemic threats, but now all threat scenarios from open source information that we have used data to accomplish this reading and risk assessment. Next slide, please. Now, the idea came about from moving from consolidated experience of its monthly reporting of the CBRNE report that is produced from Italy on a monthly basis. This report actually identifies CBRNE attacks, threats, blasts globally, and it is actually produced in a report form and sent out to key contacts, and you can register for this as well online. So the NCT and ISAP, working in partnership with the Organization for Defense in CBRNE, which I act as a scientific fellow, and its international partners, been working on the verticalization of cognitive computing technologies based on machine learning ontologies and algorithms. Now, so by developing this new solution, we customize the technological solution to a domain asymmetric risk, and with a particular experimental focus on the COVID-19 phenomena. So we rolled out this software in early July to 10 countries and to an international leading health organization. The project allowed the development of a system focused to identify in advance the information whose evidence is not yet immediate. These were weak signals due to information that we have been garnering on the OSINT, which is the open source information. And to scope the data that is likely to be considered non-existent due to impossibility of developing effective research activities, correlation and verification, which is the false negatives. Now, these are all improving on a daily basis, and as I speak, these improvements are also ongoing, and we have seen a tremendous output in the predictive analytics and machine learning scenarios for assisting organizations, governments in predicting in the near future as well as in the long-term future. Next slide, please. Now, the intelligent platform for natural, accidental, and international events, the technology adaptation. Now, I'm not a technical guy per se, so any technical information can be related to me, and I will relate that to our technical experts in answering these questions. But what I'm going to show you here is basic scenario of the technology and the software developed in addressing pandemic and other issues in relations to predictive analytics as well as in machine learning. Now, we have seen predictive analytics and machine learning in many other issues in Europe, especially in Holland. They have been running a predictive analytic course on public health. Well, you know, you need to actually be in the medical field to actually understand the public health issues of predictive analytics. So you just can't jump in there and understand what a public health official is talking when you are actually supposed to be a community volunteer in adapting to CBRNE and natural technological threats. So the platform was a customized platform that exploits advanced AI algorithms to simplify the acquisition and analysis of information and to increase the ability to find, categorize, and correlate potentially relevant knowledge. So what happens here is that we are taking all the information on the COVID pandemic globally, and then we are actually assessing it within the pandemic taxonomy and the variables that come under the pandemic issues. So the human component remains central and irreplaceable because we need information to be actually included into the data to assess the risks ongoing. So what we are trying to adapt and move forward is to garner more data from the pandemic, as well as other issues of national security threats related to CBRNE and natural disasters, as well as in other forms of threats associated to the well-being of a community. While it's possible to amplify the possibility, we're intercepting weak signals without underestimating false negatives as well. Next slide, please. So the technology adaptation is from the linguistic project. The linguistic approach is based on the rules of machine learning, as I mentioned earlier on machine learning. System is understood with the relationship between the search words and the domain of analysis. So here we're actually identifying keywords that say a organization would want to incorporate into the reports or requesting for a report analysis. The way people write, applying some of the cognitive process that humans use to understand the text. In this sense, the system learns through the knowledge base and or expansion of the linguistic roles that are created ad hoc. Now, this technology can also apply individually to organizations, creating a specific tool to their specific requirement. So we can actually adapt the software to a country specific, a global specific, a regional country specific, or an organizational country specific. So we are bringing down the adaptation as well to understanding of the business community from A to Z. Next step, next slide, please. Now, the main functions, these are the search and discovery. This is a Cognito intelligence platform. And I know you can't see much on the slide, but you can see the CBRNE taxonomy up there. And then you can see the intelligence taxonomy on the left part of the slide. And you can also see cybercrime taxonomy. So here under the CBRNE taxonomy, we have a few variables that we have identified from key specific organizations or say a country requesting for these kinds of report to be garnered and produced. So we currently see intelligence taxonomy, we see the CBRNE taxonomy, and this identifies certain threats and predicts the next near future threat for a specific country or organization and the preparedness that that one would want to look into. So these are the main functions and search and discovery for the software that has been developed for natural, accidental, and intentional events. So if you say that like Indonesia has many accidental or maybe natural, so you can highlight the natural disasters pertaining to say floods or even chemical and biological threats and put into the taxonomy, and it will kind of read and predict what are the near and far future of a certain type of attack or threat that can take precedence in the near or far future. So this will give you an understanding of preparedness way before a threat or an attack takes precedence, whether it's a natural disaster or whether it's a chemical disaster. So this predictive analytics gives the researchers an understanding of how to best prepare their organization, their country, or the tools to be implemented in understanding that specific type of disaster. Next slide, please. Now, here we see the main functions and the alerts. The functions dedicated to definition of search part for the search of investigative data of interest, and for the activation of alert messages. So what we are trying to do here is actually investigate the data that a specific organization, country, or a person is interested in, the activation of the alert messages that produces this info. The module provides a software with basic commands for creating, editing, and deleting alerts. So you can actually conduce the information that you have and provide this information into a report generating form monthly or even on a weekly basis for that matter. Now, I understand that many organizations, the UN's tool, which is open for everyone, basically also assists this. But right now, what we are trying to do here is to go deeper into it to provide a more encompassable information to provide predictive analytics into the future. This is where we are going right now, and we are developing this tool to be enhanced more in adapting to country-specific, as well as the technologies that are already available within these countries. Next slide, please. Main functions, analytics. The module provides statistics based on the acquired data, whether it's OSINT, open source information, whether it's government generated. Now, when it's government generated, of course, data protection, data security comes into play. And here we need to work with the governments in order to request for these data from country specifics. We can work directly with a government organization to specify the tool and to make it into a tool for that organization. So we can customize these software tools to adapt to a country-specific requirement. So then this data is actually maintained by the country-specific, and the information put into the software is privy only to government security agencies or government agencies, or even organizations working on prevention and preparedness of disasters. The viewing is facilitated by the use of 5 types of configurable graphics. So there are graphics to actually identify the threats and how this is will produce the report. Now, this platform and this report was generated primarily for the COVID-19 after the CBRNE report that we have been doing predictive and machine learning analytics. Now, we have combined these taxonomies now into this credible, reliable report writing source that we will be rolling out soon. Next slide, please. So main function, the case management, the module creates logical files grouping the results of analysis conducted by the software, rationalizing the information. So here you can see COVID on the far left on the case management, and then we have cyber crime and all that. And it tells you how you can actually group the threat scenarios. if it's COVID, and you can actually put SARS on it, and you can put other factors of pandemic in addressing the disasters. You can actually include chemicals of different variables into the case management that will provide you an analysis of the near future threat of something taking precedence in your specific region, country, or area or community. So next slide. I think we move on. Next slide, please. So the target management, the module is used to define the search parameter using both manual and automated parameters. Technical part on that, please send information to me and I will get back to you on this parameters of the technical issues. The user can create reports, and the module is also functional for defining alerts, allowing to identify the elements to be monitored, concept, words, places, individuals to be identified in the source acquired. So basically generating a foolproof predictive analytic machine learning report for a organization to better prepare themselves for the future, its well-being of its co-workers, its community. Next slide, please. So you see here, sorry, you will see here the coronavirus and the COVID-19 and how we have generated that information. Now the customized workflow, we collect requirements and document samples. The team, supported by expert system, develops linguistic projects based on the needs of the final user for the categorization of contents and the extraction of information. This is what I kind of explained earlier on country-specific categorization of the contents and the extraction of information. What do you want? What do you want to have? What do you want to say to your community, your company, your organization, your government, and how to make sure that they are prepared in the near long future. The results of the language projects are entered into the system by personalizing the system thinking. So you will have an understanding of what your needs are, your current capabilities, your current protection, and your current endowment to move forward in a crisis. Next slide, please. So concluding remarks. Now, workplace preparedness. The workplace is newly recognized as an important environment for implementing preparedness planning for safety and business continuity. We're seeing this globally. We are seeing people losing jobs. The economy is going bad, and things are just not going the right way because nobody predicted such a threat, you know, and this is complacency. We've had many pandemics, but you know, if it doesn't affect you, why do I care? So now it affects the global community and everybody needs to be caring. So this relates to all sorts of security threats to the well-being of the community. We cannot only say that COVID will be the first and the last. We saw the Spanish flu that took 2 years to disintegrate. And we don't know if the Spanish flu is still roaming around somewhere. It may develop into a different virus. It will mutate. We don't know if the Spanish flu was the COVID-19 that mutated. We don't know. Nobody knows about this. And everybody is doing their own research. So how do we prepare this? The new occupational exposed groups includes broad-based services, including transportation, maritime, aviation, hotels, restaurants, governments, cultural events, etc. All these sectors has been affected. Livelihoods has been affected. How do we move? How do we predict our future in the next coming 10 years? Security services and agencies, law enforcement, public health agencies are all losing out on COVID-19. Public health workers are also affected. children and teachers in school, postal workers, construction workers. These are our key areas to run a country. These are key areas to protect the country. These are key areas to make sure that humanity lives on. But with the COVID, everything has gone haywire. People are scrambling everywhere, and we are just trying to do as much as we can. So predictive and machine learning are now the new tools of technology to be introduced into the community. It is not something easy to adapt the old school of thought. I come from the old school of thought, and AI and machine learning is something that was never part of our curriculum. And the new environment dictates technology-driven skills. So how do we make this adaptable to the old school, the new school, the in-between school? So predictive analytics as well as machine learning with new experts will be the key to provide this to the international community to have a safer and better living environment. Next slide, please. So QRE is to roll out our services in the predictive and machine learning threat analysis for COVID-19 pandemic, CBRNE multi-hazard, including man-made disasters and other specific threat to country-specific requirement for risk mitigation and preparedness for business continuity. So we are producing predictive analytics with machine learning, strategic focus on threats, human and work safety preparedness, business continuity, long-term protection against livelihoods, global, regional, and country-specific risk taxonomy. So this software and this tool will provide us to provide reports to our clients as well as to government organizations. Now, the rollout will actually be provided by QRE and our partners in report producing to our clients. And further to the development of the software, it will be available to country-specific directly to governments. And the fact is here also cost remains a question, because creating a country-specific platform or individualizing the software will take some cost, and funding will be needed in order for governments or organizations to actually buy in or to get this software into their system. But on a lower scale, QRE and our partners will provide report predictive analytics based on pandemic, man-made disasters, which include all sorts of risks associated to national security and well-being of humans, including cyber, terrorism attack, biological attacks, CBRNE, and whatnot, in order for organizations and governments to be self-prepared for their business continuity. Here, when I say business continuity, I don't mean generating money, but business continuity in all forms of organizations, from universities to public health sectors, to government agencies, to even militaries and law enforcement, in order to be well prepared in the near future. Next slide, please. So before I end, I will also like to highlight that the initiation of the QRE took place during the workshop in Tohoku University, where we saw a need to provide awareness programs to communities. Government organizations are always being trained, but the communities are not. Coming from Japan and me serving as a visiting fellow at the Japan Institute in Tokyo, and understanding the security threats, I also learned that the Japanese community are very well prepared in many disasters. And although the tsunami, the great tsunami that took place, preparedness was in place. And a good friend of mine from the Japanese Coast Guard, whom I worked with, even serving in Southeast Asia and Malaysia, said that we were never ready for that major, tsunami. Everything else was in place. There was no predictive analytics. There was no prediction that the tsunami would have been a scale that no one would have thought of. So even though the Japanese were prepared for most disasters, this was something that was never in anybody's mind, for that matter. So we hope to, under QRE, to provide awareness programs, and we would like to have partners to come in to support us, to provide small courses to ASEAN organizations, communities, universities, and to provide some sort of educational. And we will also look into probably working with universities to come out with a certificate program for community building awareness on CBRNE NATEC risks within the ASEAN region with our APRU partners. And we'll hope that organizations or universities or academic institutions will come out with some sort of curriculum that and QRE and the rewarding association or academic institution can provide these kinds of programs. I understand there is a 4 or 5 day disaster risk management program at the International Disaster Science Center in Tohoku, and that is being carried out on a regular yearly summer program. At here, I would like to close and thank you for your listening to my presentation. Please send me any email requests on technicality, so I will introduce the technical information to our experts here. Thank you once again.
Okay, thank you very much, Mr. Raj, for indeed a very innovative tool. And I'm sure a lot of audience are very interested in that and learn more, learning how to use it and how to access to those new tools. So unfortunately, we don't have time to take any questions. So please allow me to introduce the next speaker. But thank you so much, Mr. Raj, for your presentation. Okay, so now, lastly but not least, I'd like to invite Mr. Jelle Peltonen from the Finnish Foreign Ministry and Diplomatic Service to summarize and wrap up the discussions today. And he's currently working for the Finnish Foreign Ministry and Diplomatic Service. He is also the deputy head for the Nordic Counterterrorism Network based in Helsinki, Finland. He is experienced and is certified global risk, resilience, and security advisor. His background as instructor, lecturer, and speaker on various security and risk management incorporating human behavior insights. He is also an expert on terrorism and a recipient of the Finnish Security Award 2018 for promoting and facilitating cross-industry cooperation and the recipient of the Cross of Merit of the Order of the White Rose of Finland for professional activities. So thank you so much, Mr. Peltonen, for taking a difficult role to summarize the discussion. And also at the same time, I'd like to hear your idea and experience on innovative tools and approaches for future preparedness and response, and what is your advice for all hazards and all society approach to tackle different types of hazard risks. So our floor is yours, Mr. Peltonen.
Thank you very much, and thank you very much for the opportunity to host this webinar today. There's a limited time remaining, but I'll be very quick about this. I put something together while I was listening to these various presentations, excellent presentations today. Well, this is what you see now. This is the basic cycle of anything related to risk management or threat management, and these various topics came up during the presentations also. What I would like to add to that cycle, which is sometimes omitted is that we need to close the cycle with lessons learned and improvement of the process. So we got everything that went well and everything that did not go so well. So it's a very important part of improving the overall process and catching anything that is lacking. Then we talked about these things, and I've put this like this, that awareness, decision making, in particular coordination resources are something that when put together in a coherent way, they build up to the culture of risk management or threat management or whatever word is used for that matter. So this, I think these all questions were discussed during the presentations from different emphasis. And then we have also lastly the question of harnessing the power of innovation. Like we heard from the first presentation, there's usually, or there sometimes can be gaps between science, technology and innovation, and how to close those gaps, how to bring these areas to interact with each other. That is a very good question, and I'm glad to see today two examples of innovative tools that have been developed to address the issues that rise in hazard or threat management. Very interesting tools indeed. Of course, it's given that we need to have this kind of multi-hazard, or should I say multi-threat approach these days, because of the increased complexities in societies and businesses and technology, and because of that we have increased vulnerabilities, and we have to be able to address those issues in a coherent ways to build up risk management strategies within the constraints of available resources. That is also a very important question. What we need is, of course, based on what I said, is cross-governmental, cross-industry, cross-functional, cross-stakeholder, even cross-scientific interaction, and kind of convergence of thinking about risk management. Because after all, in the end of the day, I think this all boils down to being about risk management or uncertainty management on various levels of government, civil society and businesses. We just need to be able to function as a whole more and more. So I think this is what I have time to say, and I like to draw pictures, so this somehow summarizes. It's not a perfect picture, of course, it's just something that I did very quickly while I was listening, but it somehow, I think, it combines everything that we have discussed during this webinar. I think this is all I have to say at this point. Thank you.
Thank you, Mr. Pertlin, for wrapping up and summarizing discussions all today. I think that's very, very well captures what we have discussed and picked up the key words from the discussions. So one quick question. We were talking about all hazards and all sectoral approaches. And based on your experience, how it will be possible to achieve this kind of a holistic approach, for example, all hazards approach, although all the hazards are different types, but how we can combine and effectively tackle these issues?
Well, it's very easy to answer. We have to have a interaction between various stakeholders, various business units, various governmental units, agencies, and so on. And this is, I think, this is what we are doing right now. We are discussing these things on a forum, and that's something that we need to carry on doing and even increase.
Yes, okay. Thank you very much for your remarks. And it was very encouraging for us because we are also doing that kind of things and try to strengthen our collaboration through this platform and the webinar series. So thank you so much. And you also kindly hosted and operated this event today from Finland. And thank you very much for your kind effort and support to the operational side too.
Thank you very much.
Thank you. Okay, so this is all for today's session, and I have to apologize. We exceed the time. This webinar continued more than 2 hours, although we said 2 hours back. So please forgive us for that. And I'd like to express a sincere appreciation to all the speakers, Dr. Ranit Chatterjee, Mr. Israel Samihaljo, and Mr. Andrin Raj and Mr. Hele Peltonen and the audience. Especially to Mr. Hele Peltonen, again, thank you so much for operating these sessions from Finland. And also the Mr. Andrin Raj, who worked very hard to prepare for and coordinate all the arrangements for this session. And on behalf of APRU Multi-Hazard, I really would like to express our deep appreciation. I do hope you and audience find this webinar series interesting and useful and learn from the presentations made by the experts. So again, inclusive, all hazards, or society, all spectral can be keywords for our future researches and works. And I look forward to our future collaboration and further discussions to tackle reducing future disaster risks. And lastly, Mr. Peltonen and reiterated, and we can achieve these things through the collaboration and networks. And also the Mr. Raj introduced a new initiative, and he is chairing. It's called CBRNE NATEC Asian Disaster Risk Initiative. So that we have, in addition to the new technology and the tools, we have quite a lot of various types of platforms and networks we can join and utilize. So through these platforms, I hope we can strengthen our collaborations and the networks we just established through this webinar series. So please be informed that the recording and slides will be shared on the APRU website. So the APRU Multi-Hazards Program will continue to plan a new webinar series for next year. So please stay tuned with us, and the information will be posted on the APRU website as well. And I'd like to encourage you to join the future multi-hazards programs such as summer school and annual symposium and more, and you can get more information from the website again. So we are really looking forward to seeing you one of these APRU multi-hazard activities. So lastly, thank you very much to all, and have a good afternoon and evening. Looking forward to seeing you again in the another opportunities. Thank you.
Thank you.
Thank you.
Thank you very much.
Thanks, everyone.
Thank you. Thank you very much.
Thank you very much.
Thank you very much.
Thank you very much.
Thank you, speakers.
Thank you.
Have a good week. Bye. Thank you.
Thank you so much.
Will be